October is Breast Cancer Awareness Month, a time not only to honor survivors, but also highlight the many ways medicine is advancing to treat this disease. And today we're joined by Dr. Wook, a radiation oncologist at Mercy's Hall-Perrine Cancer Center, to talk about some of the latest developments in breast cancer treatment, especially how radiation therapy continues to evolve. Dr. Lee, thank you so much for taking the time to speak with us.
Well, thank you for having me here today.
Yeah, no, it's good to have you here. So let's start with the basics. So can you explain how radiation therapy works in treating breast cancer?
Absolutely. So the way radiation works is that it works at the cellular level. So when radiation is delivered to the cancer cells, the DNA of the cancer cells are destroyed. Therefore, they're unable to divide, killing off the tumor cells. The normal cells, on the other hand, have a repair mechanism. So even though they may receive some radiation, much of the normal cells are spared.
Yeah, no, absolutely. And so what kinds of breast cancer patients typically benefit most from radiation therapy?
All breast cancer patients can benefit from radiation therapy. In fact, 50 to 70% of breast cancer patients receive radiation therapy. And radiation therapy is highly effective of improving local control and overall survival of breast cancer patients.
Wow, yeah, very promising there. And so we've heard a lot about new technologies improving, the precision of treatment. So can you tell us about Mercy's new TrueBeam accelerator and how it's used for patients, and what are some of the key advantages?
Yeah, so the new machine is called TrueBeam Hypersight, and it improves on three main things: image quality, speed, as well as accuracy or precision. And by improving those three things, you're able to spare more normal tissue and potentially decrease the number of treatments for our patients.
Oh, very nice. And so finally here, doctor, so as we mark Breast Cancer Awareness Month, what message do you have for women considering or undergoing radiation therapy?
Yeah, so modern day radiation therapy is highly effective and safe. And really what's important is that most early stage breast cancer are curable. And the overall survival for early stage breast cancer at 5 years is approximately 80 to 99%. So the key here is early detection. So I highly recommend patients to undergo mammograms. And the current NCCN guideline is that you start at age 40 and do yearly mammograms up to age 74. Because early detection is really key for high cure rates for breast cancer.
No, absolutely. All righty. Well, Dr. Wook, thank you so much for joining us today.
Yeah, well, you're welcome. Thanks for having me here today.
Of course.